What causes a high PSA test result? Imagine your prostate as a small gland that plays a big role in male health. When you get a PSA test, it measures a protein made by prostate cells. But a high PSA level doesn't always mean trouble. There are many reasons why PSA might be elevated, and understanding these can help you interpret your results accurately. One common cause is prostate cancer. Cancerous cells in the prostate often produce more PSA than normal cells, so higher levels can be a sign of cancer. However, a high PSA alone cannot confirm cancer because many other conditions can also raise PSA levels. It's just a piece of the puzzle that needs further investigation. Benign prostatic hyperplasia, or BPH, is another frequent cause. As men age, the prostate naturally enlarges, and this growth can lead to increased PSA production. BPH is non-cancerous but can cause urinary issues like difficulty urinating or needing to go more often. Because it enlarges the prostate, it can also bump up PSA levels. Prostatitis, which is inflammation or infection of the prostate, can cause a temporary spike in PSA. This condition may cause pain, fever, or urinary problems. The inflammation irritates the prostate tissue, leading to higher PSA readings that often return to normal once the infection is treated. Age itself plays a role. As men grow older, their prostate tissue tends to grow gradually, and PSA levels tend to increase naturally. So, what's considered high for a younger man might be normal for an older man. Infections of the urinary tract or bladder can also irritate the prostate, leading to elevated PSA. Sometimes, even recent sexual activity or prostate stimulation from procedures like a digital rectal exam, biopsy, or catheterization can cause a temporary rise in PSA levels. The size of the prostate matters too. Larger prostates produce more PSA, which can lead to higher test results without indicating any disease. Injury to the prostate or recent surgeries in the pelvic area can also cause PSA to go up temporarily. It's important to remember that a high PSA test does not automatically mean you have prostate cancer. Doctors look at PSA levels along with other factors like your age, prostate size, family history, and symptoms. They may recommend repeat testing, imaging, or a biopsy to find out what's really going on. Because many benign conditions can cause PSA to rise, a high result doesn't always mean immediate treatment is needed. Healthcare providers use the PSA test as part of a broader assessment to decide the best next steps. Always discuss your results with a healthcare professional who can interpret them in the context of your overall health and guide you on appropriate follow-up. In summary, high PSA levels can be caused by prostate cancer but are more often linked to benign conditions like prostate enlargement, inflammation, infections, or simply aging. Accurate interpretation depends on a careful evaluation by your healthcare provider, who will consider all these factors to determine the best course of action for your health.